I'm Moy-La-Monica, and I'd like to thank you for watching this video on how hypnotherapy helped me have a speedy and pain-free recovery from double hip replacement surgery. I'd like to thank first my surgeon, Dr. Anthony DiGioia, his staff, the orthopedic nurses, and the physical therapist at UMPC McGee's Women's Hospital in Pittsburgh, Pennsylvania, for a very positive surgical outcome. I think it's very important to have confidence, trust, and faith in your institution that you select and the practitioner and surgeon you select for therapies such as hypnotherapy to really be effective. And I would like to also thank my hypnotherapist, Sue Deutschlander, who is right here, and I'll let her say a few words.
Thank you. Hi, I'm Sue Deutschlander. I'm a clinical hypnotherapist, and what we do with clinical hypnotherapy is we allow the patient or the client to be in a comfortable, safe surrounding where there is a level of trust, and what we do is we relax the person into a state of mind that is very, very conducive for positive reinforcement, and it allows the part of our brain that normally lies dormant, that is so powerful, to come up and come alive and to assist us to reach any goal or any situation that we wish to have in our lives.
This is my story. At the age of 59, in the fall of 2008, I learned that I would need a double hip replacement. My surgeon, Dr. DiGioia, informed me that I was now bone on bone and that I also had a congenital defect in both my hips, in which the hips were too small for my frame. Up to this point in my life, I had never been ill, I'd never been in the hospital, never needed medications. So the thought of having to go to the hospital and go through all those procedures which were unknown to me was very frightening and put me in a horrible state of anxiety, intensified only by very severe panic attacks. Every time I thought that I would have to go through this procedure and the hospital experience, my heart began to race just uncontrollably. A good friend of mine who had double hip replacement himself had used hypnotherapy, and it was very successful. So he encouraged me along those lines. I thank him for the suggestions that he gave me, and these were the suggestions I gave to Sue. Number one, my body totally accepts the surgeon and his staff to restore my health. 2, my body will work with the surgeon in every way it can to facilitate the surgery. 3, my body is not afraid and is looking forward to this marvelous event to restore my health. 4, during surgery, my body will bleed only as much as necessary to maintain the health of the tissues. 5, my body will not feel any pain, and any discomfort will be easily overcome. 6, my body will make pain-killing endorphins around the clock and will not need any pain medication following surgery. And 7, my body will heal correctly and quickly. I then asked my surgeon if I could wait 8 months in order to prepare myself, both physically and mentally, and he said yes, I could do that. So I found Sue and asked her if she could incorporate these suggestions into hypnotherapy, which she said she could. She used such marvelous techniques and embellished upon all of these ideas. But it soon became apparent to me that there was something else going on. I continued to have major panic attacks, and I realized I had to think of a situation that gave me no concern for anxiety in order for these suggestions to really work. I then hit upon the idea of my dentist, and that's Dr. Stephen Cook of Westlake, Ohio. And Dr. Cook has been my dentist for over 30 years. going to Dr. Cook, I've had all kinds of work done, from root canals to porcelain onlays, and in those instances he's had to use Novocaine, of course, and I'd hear him drilling, but none of this ever bothered me. So then I said to Sue, can we transfer the positive experience I have going to see Dr. Cook to Dr. DiGioia? And she said this was possible. So every day I started to envision that having a hip replacement wasn't much different than having a capped tooth. And having the spinal and the procedures done wasn't any different than Dr. Cook giving me a shot of Novocaine. So between all my suggestions and my transfer of thoughts from Dr. Cook to Dr. DiGioia, several months later I suddenly had no more panic attacks. I was completely calm and relaxed. And on the day of going to the hospital, I was so excited I could hardly wait. There was just a big smile on my face as I went to anticipate this great event. Following surgery, I had absolutely no pain, zero pain, not even at the surgical site. I was able to get out of bed with very little struggle, and I had no stiffness in my muscle tissues. Everyone was amazed. I had one orthopedic nurse tell me in her 25 years, I was the first person who never needed any post-surgery pain medication. I went home from the hospital 4 days later with no pain medication and recovered extremely fast, to the amazement of my physical therapists following surgery. I had a total of 6 hypnosis sessions with Sue, and 4 months later, after my first surgery, I had my second surgery with 3 more sessions to reinforce the positive experience I had with my first surgery, transferring it to my second surgery. I highly recommend Sue Deutschlander Shine in Columbiana, Ohio, for anyone who's in the area. She did a marvelous job helping me through this experience. Thank you for listening.